Is consuming the eye pill safe? In this video, we're going to be addressing that very important question. Is taking the eye pill emergency contraceptive safe? So it's a look at the contraceptive pill and asking whether you're doing something that could cause you significant harm immediately or in the future by taking the pill to prevent an unplanned pregnancy. Let's find out. Hi and welcome back to the channel. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Here we're all about providing you with health information to help you make better decisions about your health, to feel and to be better. So if this is what you've been searching the whole of YouTube for, stop. You're here now. Don't forget to give this video a like and subscribe to the channel. And go ahead and check us out everywhere on social media, on Facebook, Twitter and Instagram as @AskAwayHealth. So what is the eye pill? The eye pill is used as an emergency contraceptive tablet after unsafe or unprotected sexual intercourse. This can include if your method fails as well. So for example, your condom has split or you forget to take your regular contraceptive tablet. Of course, you're trying to do this to prevent an unplanned pregnancy. The eye pill contains levonorgestrel, which is similar to other emergency contraceptive pills that you hear about, like Postinor or Postinor 2, Levonelle, Take Action, Plan B, and so on. Now, how does it work? Well, the eye pill and other pills like it work by preventing or delaying ovulation, that is the release of a mature egg from a woman's ovary. So what it means is that if you have sex and take the eye pill, it will temporarily not allow your egg to be released until after the sperm from that sexual act have all died. If you take the pill before ovulation, this delay will last for 5 days, which is usually the length of time that sperm will survive in a woman's body. Once the sperm have died, then you will ovulate. So please remember that if you have unprotected sex later on in that same cycle, you're not protected and you run the risk of falling pregnant. Now, how should you take the eye pill? Of course, you should follow the recommendations of the manufacturer, so read carefully the leaflet and dosing instruction that comes with the pill. But usually the pill is meant for emergency contraception within 72 hours of having sex. So we will often advise you to take it as soon as possible after sexual intercourse, which is when it is most effective. But yeah, you can still take it the day after, a couple of days after, but the longer you leave it, the less effective it will be. So don't forget, you can take the eye pill by the 3rd day, but at that point, it is less effective than it would have been had you taken it within the first 24 hours. So now let's look at the safety profile as far as we know about the eye pill and other emergency contraceptive tablets like it. Well, the following side effects are very common. 1 out of 10 women will experience headaches, nausea, lower abdominal or tummy pain, feel very fatigued, and experience bleeding that is unrelated to their menstrual period. Less common side effects affecting about 1 in 100 women will include things like dizziness, diarrhea, vomiting, delay of the menses more than 7 days, having irregular menstruation, and breast tenderness or soreness or pain. But the more rare side effects include things like swelling of the face, experiencing pain in your pelvis, and allergic skin reactions. So now, let's look at some of the common questions that women are asking about how safe the eye pill is. Number 1, does it cause cancer? First, we have no evidence from studies that show us whether the eye pill or similar emergency contraceptive pills that contain levonorgestrel, which is a type of progesterone, actually cause cancer. And these drugs have been used for many years, but in the way that the emergency pill is taken, there is no link to cancer, to causing cancer. Number 2, does it cause your blood to clot? Progesterone is a hormone, and like any other drug which contains some of the sex hormones, there may be a small risk of having blood clots. This is especially the case in women with pre-existing conditions, for example, heart disease, or they have had problems with blood clotting in the past. However, the risk of experiencing blood clots with tablets like the eye pill or Postinor and so on are relatively low. And the next question, does it affect fertility? Now, the use of the emergency contraceptive pill does not affect a woman's long-term fertility. Yes, it can temporarily delay ovulation, but that effect disappears within days after taking the eye pill. And question number 4, does the pill affect your unborn baby? According to the few studies we have available, taking the eye pill before you find out that you're pregnant does not have any adverse effects on the unborn baby, so the pregnancy can continue. And there is no scientific proof, that is from the studies that have been done, that women who were taking contraceptive while they were pregnant caused any damage to the baby's sex organs. Again, with regards to the eye pill, there is no evidence that it can cause a miscarriage. And the few studies that we have do not show a definite link between taking the eye pill and then going ahead to experience a preterm birth or low birth weight baby, a stillbirth, or having a child with learning or behavioral problems. Another popular question, number 5, does taking the eye pill cause an ectopic pregnancy? An ectopic pregnancy is when the fertilized egg develops outside the womb. Taking the emergency contraceptive pill does not increase the risk of an ectopic pregnancy. However, if you take the emergency contraceptive pill and you go ahead and still fall pregnant, so the pill failed, there is a possibility that that pregnancy may be ectopic. But while you're thinking about all this information, please remember that the emergency contraceptive pill is quite effective at preventing pregnancy overall, so that the risk of having an ectopic pregnancy altogether is low. And very importantly, after taking the emergency pill, if you experience any severe abdominal pain, any irregular appearance of your bleeding or menstrual pattern, please seek urgent medical attention. And question number 6, can you use the pill more than once? I get this a lot of times from many of my patients. So the answer is yes, you can use it more than once in a cycle or in a month. But we don't often recommend this because it can disrupt your menstrual cycle, giving you irregular bleeding pattern that takes a little while to settle down to normal. Also, if you think you have to use the emergency pill, like the eye pill, more than once in a cycle, then maybe you should be thinking about a regular form of contraception. It's worthwhile to think about that. So listen, it's always good to ensure that any medicine that you're taking is safe. And if you have any questions on this particular subject, please send them to me using our email health information service. The link for this will be in the description box below. And you may also want to check out this video where I talk about another form of birth control. In this case, it is breastfeeding birth control. Let me know what you think when you've watched it. Thank you so much for watching this video. Make sure you give it a like. Comment down below, let me know what you think, share it with a friend, and subscribe to the channel. And I will see you again very soon.